Hey everybody, welcome back to another deep dive. As nursing students, you're constantly learning about patient care. But sometimes those really fundamental aspects
Yeah.
of nursing,
Yeah.
like safety, can kind of get
Absolutely.
overlooked.
Yeah.
So today,
It's the foundation.
we're going to explore those sometimes hidden risks and surprisingly common dangers that can pop up across the lifespan,
Absolutely.
from newborns to older adults, and in a variety of settings like homes, schools, and even healthcare facilities themselves.
Yeah.
You might be surprised by what we uncover.
Well, and it's really interesting how those safety risks change so dramatically as people grow and develop. I mean, what's a major concern for a newborn
Right.
is completely different from what we worry about for a teenager, right?
Totally. Yeah.
So we need to think about safety from a developmental perspective and recognize the unique challenges at each stage.
That makes a lot of sense. So let's start at the very beginning, those precious and vulnerable newborns. What are the biggest safety concerns during those first few months of life?
Well, with infants, it really boils down to protecting their airway,
Yeah.
preventing infections, and ensuring they're getting proper nutrition. And that might seem like really basic care practices,
Yeah.
but for newborns, they're absolutely critical.
Right.
But there's another big one that many new parents aren't aware of: accidental suffocation and strangulation in bed, or ASSB.
ASSB, that sounds pretty serious.
It is, unfortunately. It's actually one of the leading causes of infant mortality. But the good news is that we as nurses can make a huge impact through education.
Okay.
You see, new parents often want to create this really soft, cozy sleep environment for their babies.
Oh, yeah.
But things like fluffy blankets and pillows, stuffed animals, and even crib bumpers can
Yeah.
actually increase the risk of suffocation.
So less is more when it comes to infant sleep environments.
Exactly. The safest sleep environment for an infant is on their back alone on a firm mattress with a fitted sheet. Wow.
No blankets, no toys, nothing extra.
Okay.
It might seem stark,
Yeah.
but it's the best way to protect those little ones.
That's super important for new parents to know. And speaking of protecting little ones, let's talk about car seat safety. It seems like every parent has a different opinion on what's best.
Oh, yeah. Car seats are definitely another area where nurses can make a real difference. The guidelines can seem a little confusing, but the American Academy of Pediatrics is very clear. Rear-facing car seats are the gold standard until the child reaches the highest height or weight allowed by the manufacturer. That means maximum support for their developing heads and spines in case of an accident.
So rear-facing for as long as possible.
As long as possible.
Got it. But even when parents know the guidelines, I've noticed they sometimes struggle with things like the angle of the seat or how tightly the harness should be.
Yeah.
What can we do to help parents become true car seat safety experts?
It really comes down to education and clear communication.
Take the time to show them how to install the car seat correctly. Let them practice and answer all their questions. We need to build their confidence and make sure they understand the importance of every detail.
Yeah.
And don't forget to remind them about the car seat's instruction manual. That's like their safety Bible.
Right. Good advice. Now, those first few months fly by and suddenly we're dealing with toddlers and preschoolers, a whole new level of energy and exploration.
Oh, yeah.
What changes in terms of safety risks during these years?
Well, think about it. We go from these relatively immobile infants to little ones who are on the move constantly
Right.
and curious about everything.
Yeah.
Supervision becomes absolutely key. But let's be honest, it's impossible to watch them every second of the day. So our focus needs to shift to anticipating dangers and making that home environment as safe as possible.
So we're talking about things like child-proof locks and cabinet latches?
Those are definitely important, but it goes beyond just those basic measures.
Right.
We need to be thinking about things like poisoning, which is a major issue in this age group.
Okay. You might be surprised to know that over 47,500 children under the age of 6 are treated for accidental medication ingestion every year.
Wow, 47,500. That really emphasizes the importance of safe medication storage. What are some other practical tips we can share with parents to prevent these kinds of accidents?
Well, there's a fantastic resource called the Home Safety Checklist, which covers everything from fire safety to medication storage. One of the simplest yet most effective tips is the toilet paper tube test.
Okay.
If an item can fit through a standard toilet paper tube, it's a potential choking hazard and should be kept out of reach.
That's a good one.
And of course, every parent should have the Poison Control Center hotline programmed into their phones, 1-800-222-2222. 1-800-222-1222. Every parent needs that number on speed dial. Now let's move on to school-age children. They're gaining more independence, venturing out into the world a bit more, but with that comes a new set of safety concerns.
You're absolutely right. Accidents are still a major concern, especially on the playground. We're seeing a rise in playground injuries, particularly those involving traumatic brain injury or TBI.
Oh, wow.
And we're not just talking about bumps and bruises here.
Right.
We're talking about concussions, which can have serious long-term consequences if not recognized and managed properly.
So playground safety isn't just about scraped knees anymore. It's about protecting those developing brains.
Right.
What are some things parents and educators should be aware of when it comes to concussion prevention and recognition?
Well, first of all, it's important to choose age-appropriate playground equipment and make sure the surface area is safe and shock-absorbing.
Okay.
Adults supervising children on the playground should be actively watching for risky behavior and intervening when necessary. And when it comes to recognizing concussions, we need to be aware of the signs and symptoms, which can sometimes be subtle.
Right.
Things like headache, dizziness, confusion, or changes in behavior can all be indicators of a concussion.
So it's about being aware, being proactive, and knowing what to look for. The CDC actually has a great resource called the Heads UP program that provides tools for recognizing and managing concussions.
Yes.
I'm sure to include a link to that in the show notes. But beyond physical injuries, there are also social and emotional factors to consider at this age, right?
Yeah.
I'm thinking about bullying, which can have such a lasting impact.
You're right. Bullying is a significant issue that can have long-term consequences for both the victims and the bullies themselves.
Yeah.
It's estimated that between 40 and 80% of school-age children experience bullying.
That's a staggering statistic. Those numbers are really concerning. As future nurses, what can we do to address this complex issue?
Well, first and foremost, we need to be aware of the different forms bullying can take. It's not always physical aggression. It can also be verbal, emotional, or social, like excluding someone from a group or spreading rumors.
Yeah.
Cyberbullying is another growing concern with the pervasiveness of social media. We need to be asking the right questions, observing children's behavior, and being ready to offer support and resources.
Okay.
Open communication with parents, teachers, and school counselors is vital.
So it's about being observant, being approachable, and creating a safe space for children to share their experiences. Now, as kids enter adolescence, they crave more independence and often push boundaries, which I imagine leads to a whole new set of challenges.
Oh, it certainly does. We see an increase in risk-taking behaviors during adolescence, like experimenting with drugs and alcohol, and unfortunately a rise in motor vehicle accidents, often involving alcohol.
Yeah.
It's a time of life when teens kind of feel invincible,
Right.
and that can lead to some dangerous choices.
It's such a tough balance, wanting to give teens the freedom they crave while also protecting them from harm.
It is. Open and honest communication is so important during these years.
Yeah.
We need to talk to teens about the risks associated with these behaviors, but we also need to be good listeners and offer non-judgmental support. Remember, teens are more likely to confide in adults they trust and feel comfortable with.
That's such an important point. It's not just about lecturing them. It's about building a relationship where they feel safe to come to us with their struggles. But beyond the typical teenage experimentation, we also need to be aware of the darker side of adolescence.
Yeah.
Things like online safety and exploitation, which can have devastating consequences.
You're absolutely right. The online world presents a whole new set of dangers for teenagers. Cyberbullying, sexual exploitation, and even the growing problem of sex trafficking are all very real threats.
Wow.
It's a harsh reality, and we as healthcare providers need to be aware of the signs and be prepared to intervene.
That's heavy stuff. I imagine it can be tough to approach these sensitive topics with teens. Any advice on how to start those conversations?
You know, the key is to approach these conversations with sensitivity and without judgment.
Okay.
We need to create a safe space for teens to talk about their experiences and let them know that we're here to listen and support them. It's also important to educate them about online safety, how to protect their personal information, and who to contact if they encounter something inappropriate or dangerous online.
It's a reminder that safety isn't just about physical well-being. It's about protecting their emotional and mental health as well. Now, as we transition into adulthood, what are some of the key safety concerns for this age group?
You know, for adults, stress and lifestyle choices play a major role in their overall health and well-being, and this definitely impacts safety.
Okay.
We see the impact of things like drug and alcohol abuse, often stemming from workplace pressures, financial stress, or relationship issues.
Yeah.
The rising trend of marijuana use among young adults is particularly concerning.
It's a reminder that as nurses, we need to be looking at the whole picture, not just the physical symptoms, We need to understand the underlying stressors and factors that might be contributing to unhealthy choices. And sadly, we can't talk about adult safety without addressing the issue of intimate partner violence, or IPV, which unfortunately affects far too many people.
It's a truly shocking statistic. Over 1/3 of women experience IPV in their lifetime.
Wow.
And that's just the reported cases.
Right.
It's likely that the true number is much higher.
That's heartbreaking. As nurses, we're often on the front lines interacting with patients in a variety of settings. What can we do to identify and support victims of IPV?
It starts with being aware of the signs and creating a safe space for patients to disclose.
Okay.
Sometimes it's as simple as asking, "Are you safe at home?" Or "Do you feel safe in your relationship?"
Right.
We also need to be skilled at recognizing those subtle cues, physical injuries that don't quite match the explanation given emotional distress, changes in behavior.
It's about being observant and looking beyond the surface. What are some specific tools or resources we can use to screen for IPV?
Well, there are several validated screening tools available, like the EE-HEITH, which stands for Extended Hurt, Insult, Threaten, Scream.
Okay.
It's a brief questionnaire that can help us identify potential cases. But even without a formal tool, simply asking open-ended questions and listening attentively can reveal a lot.
Okay.
And if a patient does disclose abuse, it's crucial to have resources readily available.
What kind of resources are we talking about? What can we do to help these patients?
Well, providing information about local domestic violence shelters, support groups, and hotlines is essential. We also need to help patients develop a safety plan, which might include things like having a safe place to go, packing a bag with essentials, or having a code word to alert friends or family if they're in danger.
It's about empowering them with information and helping them regain control in a situation where they often feel powerless.
Yeah.
Now, so far, we've focused on safety risks from infancy through adulthood, but let's shift our attention to older adults, a population that often faces increasing vulnerability as they age. What are some of the top safety concerns for this age group?
As our bodies age, so do our safety risks. Falls become a major concern, and it's not just because of decreased mobility or balance issues. You might be surprised to learn that medications affecting balance are a major contributor to falls in this age group.
You know, that's a really good point. I hadn't thought about medications as a major risk factor for falls in older adults. But I imagine the home environment also plays a significant role, right?
Absolutely. Things like slippery surfaces, poor lighting, and clutter can all create hazards that increase the risk of falls.
Right.
We need to be assessing our patients' homes for these potential dangers and offering practical solutions.
Yeah.
Simple modifications like installing grab bars in the bathroom, using non-slip mats in the shower, and removing throw rugs can make a big difference.
It's all about making those small changes that can have a big impact on safety. What about medications? Older adults are often on multiple medications, which can lead to confusion and accidental overdoses.
That's another critical area we need to address. Polypharmacy, as it's called, can be a real challenge.
Yeah.
We need to advocate for regular medication reviews, simplify regimens whenever possible, and ensure that medication storage is safe and organized. Tools like pill organizers or even electronic dispensing systems can be really helpful in preventing errors.
So it's about streamlining and simplifying to reduce the risk of confusion and accidents.
Yeah.
But we also need to be aware of the potential for elder abuse, which sadly is more common than many people realize.
It's a deeply concerning issue, and one that we as nurses have a responsibility to address at Dollery. Elder abuse can take many forms, from physical and emotional abuse to financial exploitation and neglect.
Right.
We need to be vigilant, observant, and ready to report any suspected cases to the appropriate authorities.
It's a reminder that vulnerability can exist at any age, and it's our duty as nurses to protect those who may be unable to protect themselves. Now, we've talked about safety in various settings, but let's shift our focus to the healthcare facility itself.
Yeah.
What are some of the key safety concerns we encounter within the walls of a hospital or clinic?
Well, just like in the home environment, falls are a major concern in healthcare facilities as well. Patients are often in unfamiliar surroundings, may be disoriented or weak due to their illness, and are at increased risk of falls. Hospitals are required to have fall prevention programs in place, and as nurses, we play a crucial role in implementing those programs and assessing patients for fall risk.
So those yellow wristbands we often see on patients, those are a sign that we need to be extra vigilant about fall prevention.
Exactly. It's a visual reminder that this patient requires extra attention and support to prevent falls. But beyond falls, we also need to be thinking about things like the use of restraints, which can be a controversial topic.
Yeah, I remember learning about restraints in nursing school.
Yeah.
It seems like they're only used as a last resort these days.
That's correct. Restraints, whether physical or chemical, should always be a last resort. The goal is to create a restraint-free environment whenever possible. But there are certain situations where restraints may be necessary to prevent harm to the patient or others.
I imagine it's a delicate balance between ensuring safety and respecting a patient's autonomy.
It is. The Joint Commission, which accredits healthcare organizations, has strict guidelines on the use of restraints, requiring careful assessment, documentation, and monitoring. We need to exhaust all other options before resorting to restraints, and when they are used, it's crucial to monitor the patient closely, ensure their basic needs are met, and release them from the restraints as soon as it's safe to do so.
It's a reminder that safety isn't just about preventing falls or accidents. It's about creating a compassionate and respectful environment where patients feel safe and empowered. Now, before we wrap up part 1 of this deep dive, let's broaden our scope even further and talk about population-based safety and security. What are some of the key issues we need to be thinking about at the community level?
That's a great question. We've already talked about bullying, but school safety encompasses so much more than that. We need to be thinking about violence prevention, emergency preparedness, and creating supportive and inclusive school environments where all students feel safe and welcome.
Oh, no.
There's a fantastic website, schoolsafety.gov, that provides valuable information and guidance for schools and communities.
So it's about creating that sense of safety and belonging, not just within the classroom, but within the entire school community.
Exactly. And we also need to address the issue of food insecurity, which sadly affects far too many children in our communities. School meal programs play a vital role in ensuring that all children have access to nutritious meals, but we can't stop there.
Right.
Programs like Community Eligibility, which allows schools in low-income areas to offer free meals to all students, are making a real difference in combating food insecurity.
It's a reminder that safety isn't just about physical protection. It's about ensuring that basic needs are met so that children can thrive and reach their full potential.
Right.
But even when those basic needs are met, there are still environmental factors that can impact the health and safety of our communities.
You're absolutely right. We need to be thinking about the impact of environmental pollutants on our health. Air pollution, for example, has been linked to a range of health problems, from respiratory illnesses to cardiovascular disease. We need to advocate for policies that reduce air pollution and protect the health of our communities.
It's a reminder that safety extends beyond the individual and encompasses the health of our communities and our planet.
Right. And then there's the issue of firearm injuries, which sadly continue to be a major public health concern in our nation. We need to be advocating for safe storage practices, educating families about the risks associated with firearms, and working to reduce the accessibility of firearms, especially to children and those at risk of harming themselves or others.
It's a complex issue with no easy solutions, but it's one we can't afford to ignore. Now, before we move on to part 2 of this deep dive, let's touch on a topic that has become increasingly relevant in recent years: disaster preparedness.
Disaster preparedness is crucial both at the individual and community levels. Disasters can strike at any time, and they can take many forms.
Right.
We need to be prepared for natural disasters like hurricanes, tornadoes, earthquakes, and floods, but also for man-made disasters like terrorist attacks, chemical spills, and even cyber attacks.
It's about being prepared for the unexpected and knowing how to respond in a crisis.
Exactly, and that's where organizations like FEMA, the Federal Emergency Management Agency, come in. They provide valuable resources and guidance on disaster preparedness, including how to create a disaster kit, develop a family communication plan, and find your local evacuation routes.
That's a great reminder. We'll be sure to include a link to FEMA's website in the show notes. Well, this has been a whirlwind tour of safety considerations across the lifespan and in various settings.
It really has. We've covered a lot of ground.
Yeah.
But believe it or not, there's still much more to explore.
Oh, I bet. So stay tuned for part 2, where we'll delve deeper into some specific scenarios that will challenge your critical thinking skills and really highlight how these safety concepts play out in real-world nursing practice.
I'm excited for those.
Me too.
Welcome back to part 2 of our deep dive into safety and security in nursing. Before we jump into those scenarios I mentioned, I think it's important to talk about individual factors that can impact a person's safety. Because safety isn't just about the environment, it's about understanding the patient as a whole person.
That's a great point. We've talked about developmental stages, but what are some other individual factors that might make someone more vulnerable to safety risks?
Well, think about mobility.
Okay.
Someone with limited mobility, whether it's due to age injury or a medical condition, is going to face different safety challenges than someone who is fully mobile.
Right.
Their environment might need modifications like grab bars in the bathroom or ramps for wheelchair access.
So it's about tailoring our interventions to the individual's specific needs and abilities. What about things like sensory perception? How can those impact safety?
Sensory impairments can definitely pose safety risks.
Okay.
Someone with vision loss might trip over obstacles or have difficulty navigating an unfamiliar environment.
Right.
Someone with hearing loss might not hear alarms or warnings.
Yeah.
It's important to be aware of these limitations and make adjustments as needed.
Okay.
Think about things like large print labels, visual cues, or assistive listening devices.
It's about adapting the environment to make it safer and more accessible for everyone. I imagine a patient's knowledge level also plays a role in safety.
Absolutely. If someone doesn't understand the risks or how to protect themselves,
Right.
they're more likely to be injured.
Right.
Think about a patient who doesn't know how to use a walker properly,
Yeah.
or a parent who isn't aware of the dangers of leaving medications within reach of children.
Right.
Education is key.
Yeah, it's not just about telling people what to do. It's about empowering them with the knowledge and understanding to make safe choices. And what about communication ability? How can that impact safety?
That's an important one. Someone who has difficulty communicating, whether it's due to a language barrier, a cognitive impairment, or a speech disorder,
Right.
might not be able to express their needs or ask for help when they're in a dangerous situation.
That makes sense. We need to be patient.
Yeah.
Use clear communication strategies and really advocate for those patients to ensure their safety. Now, we've talked about physical and cognitive factors, but what about psychosocial health? How does that tie into safety?
You know, mental and emotional well-being play a huge role in safety. Someone who's experiencing stress, anxiety, or depression might be more prone to accidents
Yeah.
or engage in risky behaviors.
Right.
It's important to address those underlying issues and provide support.
So it's about recognizing that safety is holistic.
Mm-hmm.
It encompasses the whole person, not just their physical body.
Exactly. And let's not forget about those social and environmental factors we touched on earlier. Things like socioeconomic status, access to healthcare, and even the neighborhood someone lives in can create vulnerabilities and impact safety in profound ways.
It's a reminder that safety isn't just an individual responsibility. It's a societal issue. We need to be working to create safer and healthier communities for everyone.
Absolutely.
Right.
And that's where nursing advocacy comes in. We have a responsibility to speak up for those who are marginalized or at risk, to push for policies that promote safety and well-being, and to create a more just and equitable healthcare system for all.
It's about using our voices to make a difference and championing safety for everyone, regardless of age, background, or circumstance. Okay, so we've covered a lot of ground in terms of the factors that can influence safety. Are you ready to dive into those scenarios now?
I am. These scenarios are designed to really challenge your critical thinking skills and highlight how these seemingly abstract concepts translate into real-world nursing actions.
Okay, let's hear them. I'm ready to put on my nursing cap and see if I can spot those potential hazards.
All right, scenario number 1. You're a nurse working on a busy medical surgical unit.
Okay.
You're caring for an older adult patient who was admitted with pneumonia. The patient is weak and a bit confused, and they keep trying to get out of bed without assistance.
Okay.
What are your safety concerns?
Okay, so we have an older adult patient who is weak, confused, and trying to get out of bed without help. Those are 3 major risk factors for falls right there. I'm definitely concerned about this patient falling and injuring themselves.
You're right to be concerned. Falls are a major risk for hospitalized patients, especially those who are older, weak, and confused. What are some steps you could take to prevent this patient from falling?
Well, first, I'd make sure the bed is in the lowest position and the wheels are locked. Then I'd assess the patient's need for a bed alarm.
Okay.
Some hospitals use those sensor pads that go under the patient and trigger an alarm if the patient tries to get out of bed. I'd also make sure the call light is within easy reach and encourage the patient to call for assistance before getting out of bed.
Those are all excellent interventions.
Yeah.
What else could you do? Remember, we want to consider the patient's environment and individual needs.
Well, if the patient is confused, I'd make sure they have frequent reorientation. I'd remind them where they are, why they're in the hospital, and who I am. Maybe I could even put up some familiar pictures or objects from home to help them feel more grounded.
Those are great ideas. Creating a calm and familiar environment can definitely help reduce confusion and agitation, which can, in turn, decrease the risk of falls. You could also consider involving the patient's family or friends. Having a familiar face at the bedside can often provide comfort and reassurance, which can help the patient feel more secure and less likely to try to get out of bed on their own.
That's a good point. It's all about creating that sense of safety and security, both physically and emotionally.
Okay.
Okay, let's move on to scenario number 2. This time you're a school nurse and you're called to the playground because a child has fallen off the monkey bars and hit their head.
Uh-oh.
When you arrive, the child is crying and holding their head, but they're alert and talking. What are your initial actions?
This is a classic head injury scenario, and it's one that school nurses encounter all the time. It sounds like this child might have a concussion, so it's important to assess them carefully. What are some key things you'd be looking for?
Well, first, I'd want to make sure the child's airway is clear and they're breathing normally. Then I'd check their vital signs, looking for any signs of shock or increased intracranial pressure, like a slow heart rate or irregular breathing. I'd also assess their level of consciousness, asking them simple questions like their name, the date, and what happened.
Excellent. Assessing their level of consciousness and neurological status is crucial in a potential head injury. What else would you want to assess? Think about the mechanism of injury and the potential for other injuries.
You're right.
Yeah.
Since the child fell from the monkey bars, I'd want to check for any other injuries like fractures or sprains. I'd examine their head carefully, looking for any bumps, bruises, or bleeding, and I'd ask them about any pain or numbness they're experiencing.
Good thinking. It's important to remember that head injuries don't always present with obvious signs or symptoms. What would you do next? Would you let the child go back to playing?
Absolutely not. Even if the child seems okay, initially, head injuries can be tricky. Symptoms can sometimes develop later, so it's important to monitor them closely. I'd keep the child in the nurse's office for observation, continue to assess their neurological status, and contact their parents to discuss the situation and recommend further evaluation by a healthcare provider.
You're exactly right. It's always better to err on the side of caution when it comes to head injuries. And speaking of caution, let's move on to our final scenario for part 2. Imagine you're working in a busy emergency department. A young man is brought in by ambulance after a motor vehicle accident. He has multiple injuries, including a head laceration, a possible broken leg, and several abrasions.
Okay.
The paramedics tell you that the patient was driving under the influence of alcohol. What are your priorities in this situation?
This sounds like a complex trauma case.
Oh.
With multiple injuries and history of alcohol use, there's a lot to consider. But first and foremost, I'd focus on the ABCs: airway, breathing, and circulation. I'd make sure the patient's airway is patent, assess their breathing and respiratory rate, and check their pulse and blood pressure.
You've got it all. The ABCs are always our top priority in a trauma situation. What would you do next? Think about the potential complications of a head injury and alcohol intoxication.
Well, I'd be concerned about potential intracranial bleeding, so I'd want to assess the patient's neurological status frequently. I'd also be worried about the effects of alcohol on the patient's level of consciousness and their ability to cooperate with treatment.
Excellent points. We also need to consider the impact of alcohol on the patient's pain perception and their ability to communicate effectively. What are some other things you'd be thinking about in this situation?
Well, with a possible broken leg, I'd want to assess for pain, swelling, and deformity. I'd immobilize the leg and elevate it to reduce swelling. And I'd definitely want to get imaging studies done to confirm the fracture and rule out any other injuries.
You're on the right track. We also need to consider the patient's history of alcohol use. We might need to monitor their vital signs more frequently, watch for signs of withdrawal, and consider the potential for interactions between alcohol and any medications we might need to give them.
That's a great point.
Yeah.
It's a reminder that we need to be aware of all the factors that can impact a patient's care, including their social history.
Absolutely. And that brings us to the end of part 2 of our deep dive.
No?
We've covered a lot of ground, from individual factors that can impact safety to real-world scenarios that highlight the importance of critical thinking and clinical judgment in nursing practice.
It's been a great learning experience so far. I'm really starting to see how all these pieces fit together and how important it is for nurses to be aware of the potential for harm and take steps to prevent it.
I'm glad to hear that. Now in part 3, we'll wrap things up by discussing some key takeaways and resources that you can use to continue your learning about safety and security in nursing. Stay tuned.
Welcome back to the final part of our deep dive into safety and security in nursing. We've covered a lot of ground, from the unique safety concerns of each developmental stage to real-world scenarios that challenge our critical thinking skills. It's been quite a journey.
It really has. We've explored safety in homes, schools, hospitals, and even at the community level. And while each setting presents its own unique challenges, there are some common threads that run through all of them.
Absolutely. What are some of the key takeaways you'd like our listeners to remember from this deep dive?
Well, I think one of the most important things to remember is that safety is everyone's responsibility. It's not just the nurse's job to ensure safety.
Yeah.
It's a team effort that involves patients, families, and other healthcare professionals.
That's a great point. We can't do it alone.
Right.
We need to be communicating effectively, sharing information, and working together to create those safe environments.
Exactly. And speaking of communication, I think another important takeaway is the power of clear and effective communication.
Yeah.
Whether we're educating patients and families about safety risks, advocating for our patients' safety, or reporting safety concerns to other members of the healthcare team,
Right.
clear communication is essential.
I couldn't agree more. And we've talked a lot about the importance of assessment, right?
Yes.
Whether we're assessing a patient's fall risk, monitoring their neurological status after a head injury, or evaluating their home environment for potential hazards, those assessment skills are crucial.
They absolutely are. We need to be using our senses, gathering information, and critically analyzing that information to identify potential risks and take appropriate actions.
And sometimes those actions involve advocating for our patient's right.
Yes.
Whether it's advocating for a bed alarm, requesting a medication review, or reporting suspected elder abuse.
Right.
We need to be willing to speak up for those who can't speak for themselves.
You're exactly right. Advocacy is a core principle of nursing, and it plays a vital role in ensuring safety.
Now, I know there are a ton of resources available to help nurses stay up to date on safety practices and guidelines. What are some of the go-to resources you'd recommend for our listeners?
Well, the Centers for Disease Control and Prevention, or CDC, is a fantastic resource for information on a wide range of safety topics. From fall prevention to medication safety to disaster preparedness. They have evidence-based guidelines, toolkits, and even training programs that can be really helpful for nurses.
The CDC is definitely a go-to resource for reliable information.
Yeah.
What about professional organizations?
Well, the American Nurses Association, or ANA, has a strong focus on patient safety and provides resources and education for nurses on topics like safe patient handling, medication safety, and workplace violence prevention.
Okay.
And, of course, the Joint Commission, which accredits hospitals and other healthcare facilities, has rigorous safety standards that hospitals must meet.
Right.
So they have a wealth of resources on safety topics as well.
It's amazing how many resources are available to help us be the best, safest nurses we can be.
Right.
It really highlights how important this issue is.
It really does. And remember, learning about safety is an ongoing process. It's not something you learn once and then you're done. It's about staying curious, staying informed, and always striving to improve your practice. So true. We have to be lifelong learners, always seeking out new knowledge and keeping those safety radars on high alert.
Well said. And remember, you don't have to have all the answers. There's a whole community of nurses out there who are passionate about safety and eager to share their knowledge and experiences. Don't be afraid to reach out, ask questions, and learn from each other.
It's a reminder that we're all in this together, working towards the common goal of providing safe, compassionate, and high-quality care to our patients.
Well, I think that brings us to the end of our deep dive into safety and security in nursing. What a fantastic conversation.
It really has been. I hope our listeners feel empowered to be those amazing safety-conscious nurses we know they'll become.
Absolutely. Stay curious, stay engaged, and stay safe out there. And remember, you have the power to make a real difference in the lives of your patients.
That's a wrap for today's deep dive. Until next time, keep learning, keep growing, and never stop advocating for safety.